In this video, we're going to go over Jasmine's key supplies. So, Trichostomy Tube probably is the most important supply for Jasmine. And Jasmine is using pediatric trach flex end standard. This is the model number 60 PFSS45 and have all of the specification over there. And this is how it looks like. And you notice that's the straight flange because Jasmine has a very narrow neck. There is another type that is V shape, doesn't work for Jasmine. So you can see this is 4.5 by Vona pediatric straight flange. Please notice that. Put them together. This is how it looks like from the package and the real trick. And this is the passing mirror. You can see this is a passing mirror, can be hooked up into the circuit. It's in green color. I will demonstrate how it can be hooked up into the circuit with a silicone adapter. This is how it looks like. So pretty much connect to the silicone adapter, and at the other end, I can demonstrate how it be connected. It's very soft and easy to plug in the passing mirror. Then make sure it's connected securely. Then the other end, the passing mirror side will connect to the trach, and the other end is gonna connect to the circuit. That's the ventilator circuit. That's for the portable ventilator. That's why you see a blue HME over there. So that's how everything put together. And this is Jasmine's tie, tail. 241, 242. I think both works very well. I've been using for years. Tree care kit. It's a sterile, 4 sterile gauzes and extra split 4x4. I forgot to show the reference number for the Trichostomy kit. And this is an inline suction catheter hooked up into the circuit, and one end connect to the trach. It is A French and has a label inside, so you can put for the date, changing date. We usually change every 3 days. And you can see the A French. Jasmine's G2 button is a mini one, balloon button, and it's very soft. And last time I changed it was in January. I forgot to take a picture, but the specification is 16 French and 1.5 centimeter. This is the Mini One G-tube extension. It's for fitting. You can see the reference number is that, and it's 12-inch right angle fitting set. You see the purple one, it's connected to the syringe for fitting, and the other end is connected to the button. Yeah, that's connected to the button, G-tube button. This is the HME, can be plugged into the circuit, pretty much for the portable ventilator, and you see the model specification. And this is how it looks like into the circuit. And this is a yank. We used to use it for mouth suctioning, cleaning stuff. But recently, Jasmine has a lot of choking. We stopped using it. So be careful if you want to use it. And this is an external suction catheter, 8 French as well. It looks like it has sterile gloves inside and a paper cup sterile and suction catheter inside. This is how the package come with, like 10 packs in 10 pieces in one pack, pretty much. Saline bullet, 5 ml for each vial. We use it for many purposes, like rinse the tip of the inline suction catheter and also cleaning her lips, and it's very useful. This is how it looks like, the bullet. This is the 2x2 sterile gauze. I think it's a split, so you can use for trach, pretty much under the trach, and this is a reference number. You see, it's a split. This is 4x4 gauze, sterile. We use it for all sterile process, mainly for trach care, combined with sterile water, so we can cleaning the trach side, and very useful. And that's the reference number. And this is sterile water. We use it for trach care exclusively, pretty much for trach care, because the trach care we follow a sterile process. And this is a long sterile gauze, 4x4. Usually we use it to clean her lips, her mouth. Yeah, for general use. Sometimes wipe her eyes. I wipe with the eye ointment. Yeah, this is we use it very often, so we put on the bed, just on the corner of her bed. This is Jasmine's formula. Pediasure peptide. It's calorie 1 calorie per ml. We give her about 3 bottles a day. One in the morning, the first feeding about 8:30. Another one in the afternoon after her nap about between 3 to 4. And there's another one we give her in the evening, probably 6 or 7. Again, this is gonna be evaluated by the nutritionist. I guess it's due for assessment. And for her lunch, we give her the homemade food, which is I made it usually. Every time I made it 2 or 3 weeks supply. Every day we give her 1 cup, like this. For her lunch, this is purely for her lunch. This is made of beef or chicken with veggie, with potato, some sweet potato with a lot of celery or carrots. So it's meat and the veggie mixed together, and then blend it and make it like a puree. Then save it into this type of cup, and for her lunch, or I put it into the freezer. Every time I made about 14 to 20 cups like this. That's Jasmine's feeding. In some cases, not very often, she does have some rash on her bottom. We use dusting. This is for baby stuff. But especially after we apply Miralax, if she has a very liquid poo-poo for like 3 times a day, that sometimes happens when we give her Miralax. So we apply dusting after changing diaper, after wipe her bottom, and to protect her skin.